You just finished a meal full of rice, pasta, bread, or a sweet dessert, and your blood sugar is now spiking. The good news is, within just 15 to 30 minutes, you can bring it down without medication, without hours of exercise, and all of it is backed by science. You might feel fine, but repeated spikes quietly damage your arteries, nerves, and liver. Stick around. Method number 6 is the pro trick elite athletes use, and it works for everyday people too. If you have type 2 diabetes, prediabetes, or simply feel tired after eating, these blood sugar spikes not only make you feel sluggish immediately, but they also silently damage your blood vessels, nerves, and liver. Most people believe only medication can fix this. But the truth is, you can lower your blood sugar quickly with a few simple actions. In this video, I'll share 7 science-backed ways to lower your blood sugar almost instantly. Some take just 5 to 7 minutes and keep working for hours afterward. These are techniques even doctors recommend to their patients to control post-meal spikes. And if stubborn spikes are your struggle, method number 5 tends to drop numbers the fastest. Let's start with the fastest one. It only takes a few minutes, and it turns your muscles into powerful sugar vacuums. Tip number 1, HIIT. Turn your muscles into sugar vacuums. If you want the fastest blood sugar drop, make your muscles work. The most effective way is high-intensity interval training, HIIT. Don't worry, you don't need a gym or expensive equipment. When you perform short bursts of intense movement, your muscle fibers burn through stored sugar quickly. Then, they act like sugar vacuums, pulling glucose from your bloodstream to refill their energy, and they do this without insulin. The result? Your blood sugar drops almost immediately, and the effect can last 24 to 48 hours. A 2024 meta-analysis of 22 randomized controlled trials found that HIIT lowered A1C, fasting glucose, triglycerides, and LDL, while boosting HDL. Results were strongest in people under 60 or within 5 years of diagnosis, but even older adults benefit significantly. You only need 3 to 4 sessions a week, under 10 minutes each. For example, 30 seconds of all-out effort like jump squats, fast cycling, or jumping jacks, then 1 minute of rest. Repeat 5 to 7 times. No gym required. If you have heart disease, joint issues, or haven't exercised in years, start lighter and build up. Always warm up and stop if you feel dizzy or in pain. Try HIIT right after this video and track your blood sugar. Many people see results after just 1 to 2 sessions. But if you want something even simpler, just 1 small drink before your meal can work wonders. Let's talk about tip number 2. Tip number 2, apple cider vinegar. Cut post-meal spikes by up to 34%. If HIIT feels too active, this one's much easier. Just a small glass of water before your meal. And it's been confirmed by dozens of studies, apple cider vinegar. Apple cider vinegar contains acetic acid, which slows down stomach emptying. That means carbs from your meal enter your bloodstream more slowly. It also helps your muscles absorb glucose more efficiently, taking pressure off your insulin. Just 1 tablespoon of apple cider vinegar in 8 ounces of water before a meal can reduce your post-meal spike by 20 to 34%, especially after carb-heavy meals. How to use it? Mix 1 tablespoon into a glass of water and drink 10 to 15 minutes before your main meal. Use a straw, rinse your mouth afterward, and never drink it undiluted to protect your teeth and esophagus. If you have stomach ulcers or acid reflux, check with your doctor first. If this already helps, don't skip ahead in a minute. I'll show you method number 5, the fastest drop for stubborn spikes, and method number 6, the athlete hack. Tip number 3, Berberine plus NACALA, nature's metformin. Berberine works directly on the systems that regulate blood sugar. It's called nature's metformin because its effects are comparable to the drug, but with fewer side effects. Berberine activates AMPK, your cell's energy regulator, which boosts fat burning, lowers glucose production in the liver, and helps muscles pull sugar from the blood. The result? Lower blood sugar and A1C. Over 50 clinical trials show berberine can lower A1C, fasting glucose, insulin resistance, and improve lipid profiles. Pairing it with NAC, N-acetylcysteine, or alpha-lipoic acid adds protection against oxidative stress and nerve damage. Recommended dose: 1,000 to 1,200 milligrams of berberine daily, split into 2 doses with meals. NAC is usually 600 milligrams per day. ALA is 300 to 600 milligrams per day. Do not use if you are pregnant, breastfeeding, or taking multiple blood sugar-lowering medications without supervision. Berberine and NACALA are powerful, but if you want a no-cost method that works right after eating, that's tip number 4. Tip number 4, post-meal walk, the 15-minute fix. Just finished a carb-heavy lunch or dessert. Don't sit down. Walk for about 15 to 20 minutes. When muscles are active, they don't need insulin to pull glucose from your blood. This is called contraction-mediated glucose uptake, like turning on a vacuum to suck sugar out of your bloodstream. A 2017 study found that walking for 15 minutes right after a meal lowered post-meal glucose more effectively than a single 45-minute walk later in the day. Do it after lunch and dinner for a compounding benefit. Walk at a moderate pace, breathing a bit deeper than normal. If you can't walk that long, split it into 2 to 3 shorter walks. Avoid walking immediately after eating if you have acid reflux. Wait 10 minutes, then start. Post-meal walking is easy, but if you want to combine it with fasting for even bigger results, that's tip number 5. Tip number 5, fasting, dry fasting. When you pause eating for a period, your body automatically lowers blood sugar and switches to burning fat. The most common method is 16 to 8 intermittent fasting. Eat within an 8-hour window. Fast for 16 hours. During the fast, insulin drops, your body burns stored fat and glucose, and blood sugar falls naturally. Dry fasting, no food, no water, creates a bit of good stress, boosting growth hormone, burning fat faster, and lowering blood sugar more aggressively. But it's an advanced method that requires adaptation and careful monitoring. Studies show both water fasting and short dry fasts can improve insulin sensitivity in just days. But if you have medical conditions or are pregnant, always consult your doctor first. Fasting helps at a systemic level, but if you want your body to keep absorbing sugar even at rest, you need tip number 6. Tip number 6, resistance training. Upgrade your sugar storage. Walking and HIIT turn muscles into sugar vacuums, but if the vacuum is small, its capacity is limited. Building muscle through resistance training enlarges your glucose storage tank, keeping sugar in a safe range and reducing insulin demand. Aim for 3 to 4 sessions per week, 30 to 40 minutes each. Do full-body movements like squats, push-ups, resistance band pulls, or light weightlifting. If you have joint or heart issues, consult your doctor first. Building muscle is a long-term investment, but there's one silent factor that can undo all your efforts if you ignore it. Sleep and stress control, tip number 7. Tip number 7, sleep and stress. The hidden key. You can eat perfectly, exercise regularly, and take the right supplements. But if you sleep poorly or live under constant stress, your blood sugar will stay stubbornly high. Just one night of 4 to 5 hours of sleep can reduce insulin sensitivity by up to 25% the next day. Get 7 to 8 hours of quality sleep, keep your bedroom cool and dark, and avoid caffeine after 2 p.m. Magnesium glycinate, 275 milligrams, before bed can help relax your muscles and promote deeper sleep. Stress triggers cortisol, a hormone that signals your liver to release glucose into the blood. Try 5 minutes of deep breathing before bed, light meditation, or a relaxing walk outdoors. Ashwagandha can also help lower cortisol and improve sleep quality. So here are your 7 ways to drop blood sugar fast. HIIT, apple cider vinegar, berberine plus NAC, post-meal walks, fasting, resistance training, and optimizing sleep and stress. Apply 2 to 3 of these this week, and you'll see results. Choose one you'll try today. Tiny wins beat perfect plans. Pick one tip and try it today, then comment "drop" plus your before/after numbers. I read and reply to every single one. If this helped, subscribe and tap the bell so you won't miss what's next. And to go beyond quick fixes to reverse insulin resistance for good, watch this next video. 8 life-changing strategies to beat insulin resistance now. It's the perfect next step after this one.